The opioid epidemic is the public health crisis of our times. And we have, as physicians, have to be responsible in owning our part in that.
People from all walks of life, all economic brackets, all education levels, this epidemic does not have any boundaries.
The Department of Safety and Professional Services really relied upon the prescribers in the healthcare community. We had a group of users providing pretty much continuous feedback at each step in the development process, whether that was design, testing, or implementation.
DSPS is proud and excited that Wisconsin's ePDMP is getting national attention for its ease of use and is being looked at as the new national standard.
I think this system will be helpful to a lot of groups of individuals. It'll be helpful to our prescribers, our providers, our pharmacies, to be able to work with our consumers to have appropriate prescribing. It'll be helpful to our public health domain folks so that they can look at what's happening within our state.
In the past, it was very difficult to get a hold of the data. The system was old. It was not very user-friendly at all.
When I've signed up for the PDMP on the new interface, it is much more user-friendly.
The first thing that healthcare providers will notice in the Enhanced Prescription Drug Monitoring Program is its reliance upon data visualization. We actually provide several different views into the information, including mapping features and analytics that will provide alerts when there's data that may be of higher concern than others.
For me, just being able to click the button and be able to see a graph and see that the patient is taking no opioid medications, that's enough for me. I don't need to look anywhere else, and that might take 3 or 4 seconds, instead of 4 minutes or 5 minutes.
I think it fosters a greater transparency in the process of taking care of patients, so that we are all on the same page in terms of what really is being prescribed to them, and that can facilitate better dialogue.
It gives us the full clinical picture of the patients we're seeing. It will help diminish doctor shopping and pharmacy shopping.
The biggest misconception about the ePDMP is that it's only for opioid prescribers and opioid dispensers to use. It's a system that tracks the dispensings of all controlled substances. That includes opioids, but it also includes benzodiazepines, stimulants, and other controlled substances that don't fall into those categories.
The thing that we thought was very important was we know that physicians don't do everything one particular way. So what we wanted to do was make it configurable so that it can work for your practice.
The feedback from users has been built directly into the system and will continue to be built into the system.
I think that there is a concern across providers, and myself included, about really there are a lot of competing demands when we're taking care of patients. This is just another hoop to jump through. Is it another hoop? Yes, in a way, but it has a good bang for the buck.
And the collaboration between DHS and DSPS provides us expertise in public health, expertise in substance abuse, expertise with our licensees, and with that we can create an ePDMP that's very successful, very robust, and very helpful to the end user.
DSPS looks forward to continuing to work alongside our stakeholders to ensure that we are able to combat the opioid epidemic.
It's very important for this to not just be a regulatory burden we have to find a way around or step over. This really needs to impact us better clinically, and I think it will.